basically we can take hair from the scalp or other areas of the body and we can transplant it to any other areas. One large part of our practice is actually reconstructive surgery, and patients that have scars or trauma signs of scars in their face, eyebrows and the beard or other areas, we can actually cover those areas with hair. Even patients that don't have an accident, they just, as we get older, it's normal for our eyebrows to become thinner, or a lot of times female patients will wax their eyebrows and they end up losing everything in the process, or a man wants to grow a full beard and has gaps in there. So those areas are really good for transplants. We do a very large amount of facial hair transplants. There are some particularities on how you want to do it because it's the angles of the hair, the direction, you have to have an understanding of that. But it's really nice. The results are really natural and is a good match between the scalp hair and the facial hair.